to me, Albany is the best part of Northwest Missouri. I don't know if it's the rolling hills or what it is, but there's just something that's transcendent, and it's almost magical, and it gives you that warm feeling that you want to be a part of it.
So I'm an Albany kid. Was born down the hall here in the hospital. The character of the people who live in this area is that they're here for each other. There's a sense of mutual investment, and there's a sense of pride.
Think back to those people back in the late 50s, early 60s, when they were thinking, you know, we need to have a hospital here. So they didn't wait for somebody else to do it. They went door to door, they went neighbor to neighbor, to friend, and said, hey, we need this hospital. Would you like to help us? And people did, because they're from Albany. That's what they do.
My time here meant a lot. I began at Northwest back in 1978. We had loyalty, we had pride, we had a family atmosphere. It seemed that we were always trying to be on the cutting edge, always looking ahead. We geared more to the outpatient area. And in between there, we added different things to the hospital as well, had additions. Just tried to keep up on the cusp of everything that was new and keep our hospital viable, because it means a lot to the community to have the institution here.
In a county of 6,500 people, in a town of 1,700 people, our lot in life is to provide extraordinary primary care. There are a number of organizations like ours in places like ours who do a fantastic job of providing the care that isn't particularly well compensated today. And in the end, there's a policy decision that is made at the federal level and the state level. And if they decide that high quality health care isn't essential in rural areas in this country, it will put continued strain on people who are trying to provide that care. As we contemplated the Northwest Medical Center desire to become part of something larger, we didn't send out RFPs to 3 or 4 organizations. We already had a natural partner. And what we saw in Mosaic was an organization that for decades had sent resources here, had cared for people here, had cared about people here.
I think you know good people. I mean, you know, when you meet somebody, you're thinking, yeah, I could be friends with that person. I trust that person. And that's the way it is with Mosaic. Their number one thing is our patients and their well-being. And obviously that's what we're all about too. And so I felt really at home with them. I felt a connection, and I felt like I could recommend that to my people on our board.
Through the trust that was built and the relationships that were built between the Mosaic Board, the Northwest Medical Center Foundation Board, between leaders and caregivers from both organizations, we hatched this idea of mutual investment in the hospital campus here in Albany and in our clinic locations in other areas. And so as we roll forward now in this partnership, we continue to innovate, we continue to try new things. And we've certainly added traditional capabilities. You can walk down the hall and see a beautiful CT scanner in gorgeous new space that has way shortened the time it takes for us to diagnose patients when they come into the emergency department. Truly, that level of investment was not required. It absolutely saves lives and improves quality of care here.
I think even with the changes made, I think we still have that family atmosphere. Even though I'm not here on a day-to-day basis, it feels like I'm coming home. I still have the smiling faces, the hugs from the employees that are still here that I know. We have a lot of memories together, and so for me, it's still home. It's changed, but it's still home.